So thanks everybody for coming. It's really nice to see faces, especially now during this crazy time when we can't see each other in person. And thank you, Sydney, for putting up this workshop. So we're brought to you by the Center for Independence of Disabled and
Right.
the ICS Health Home. So the ICS Health Home is not a place to live. It's a program of people who are experts in caring for people with physical disabilities, and we work to keep members as healthy as possible in your homes. It doesn't replace managed long-term care services, but provides additional support at no cost to members. ICS services are fully paid for by Medicaid, and you can learn more if you are interested on our website. Before we start, please mute yourself. We recommend using the speaker view and feel free to ask questions in the chat box. This was in the invitation, but we just want to reiterate that the workshop is being recorded. So by taking part, you're consenting that we may use or our partners may use or distribute the content. And then we do this so that people who are not able to attend can have the benefit of getting the information afterward. Captioning is available for anyone who needs captioning. Here are the instructions. I guess we'll just leave this on the screen for a moment and give you some time to read this if you need to set up your computer or your phone for captioning. Okay, and with that, I'm going to mute myself and turn this over to Margie from Sydney.
Hi, everybody. It's great to see faces, as Regina said, and it's lovely to be here today. A couple of housekeeping notes. We're going to be sending out a PowerPoint for you, as well as some fact sheets, so that you'll have all the information that we're talking about today, plus links to other sites that can give you more information. We're going to be sending you fact sheets and then also a list of all of the testing sites in New York City by borough. So what we're going to be talking today about is the virus and how to get tested and what happens if you test positive, and what is the tracing issue that comes up. I'm going to go through some of this pretty quickly since most of you, I think, will probably know the information, and you'll have the PowerPoint later to remind yourselves. But as you know, the COVID-19 virus is a severe respiratory virus that's highly infectious. And the symptoms for it include things like fever, cough, shortness of breath, loss of taste or smell. But also people can get COVID and not show symptoms, which is one of the reasons it spreads so quickly and so easily, right? Also, just a refresher, the virus is thought to spread among people who have close contact with each other. So that's under 6 feet, although the CDC has come out with guidance that says it's under 12 feet. So, you know, I think you just have to decide what your risk level is. It's travels through respiratory droplets. So if somebody is coughing or sneezing or talking loud at you, you are likely to get droplets near you. And it's your nose, your eyes, and your mouth that are the places where the virus can get into your system. So, you know, the things we all have heard: wash your hands frequently for at least 20 to 30 seconds. Soap and water is best, but if you don't have that, use hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. So if you know, if you have to scratch your face or something, go wash your hands first. You want to cover sneezes and coughs as much as possible when you're around other people, and you certainly don't want that on surfaces if you can help it. I think all of us know to avoid people who are sick and stay home if you're sick. Yeah. The test, has anybody taken the test? Regina has. I can't see everybody else. But anyway.
Yes.
Sorry?
Corinne, I have.
Oh, and
Yeah.
Capricia has? Okay, great. So the test is usually done with a nasal swab. They do have oral swabs or saliva samples, but I've not known about that in New York City. I don't know. If you test negative, you should get tested again if you've had exposure to somebody who may have the virus, or you've spent time in a crowd. If you have symptoms, or if you actually go to work or go to an area where you're in a crowd of people. The results from the tests are said to take 3 to 5 days. Is that your experience? Regina, Corinne? Yes? Okay. The test is free. You don't need insurance to take the test. And the test results are confidential. One of the things to note, if you have friends or you are someone whose immigration status is an issue, you will not be asked about your immigration status or your citizenship status. The Health and Hospitals Corporation Hospitals offers free testing, and you'll get the list of those testing sites in each borough. You can just walk or roll into the testing sites. You don't need an appointment. Although you might want to call ahead. One of the things we don't know is whether all of the sites are fully accessible. And that may mean, do they have ASL interpreters or some way to communicate with you if you're deaf or hard of hearing and you need that kind of communication. We don't know how it is for somebody who is blind, whether they have people who can guide you easily. But we do know that they say that most of their sites are accessible to people with disabilities. My suggestion is that you call ahead. I don't know for Capricia whether she was able to do her testing easily. Yes? Okay. Not all the testing sites that are listed are HHC sites, Health and Hospital Corporation sites. So again, you may want to call ahead. Some of them may charge you, and you really want to go to a free site if you can, I'm sure. So if you test positive, you're going to be contacted by city tracing folks. And there are several questions they're going to ask you. They're going to ask you how you're feeling, if you need services and support to help you stay healthy and to avoid spreading the virus. They're going to explain how long you need to stay inside and away from others. They are going to ask you how you think you got infected. And they're going to ask you for the names and contact information for people you've been in touch with in person. So those things are very important so that the city can follow up to make sure that people who may have been exposed know they are and can get help. There are a number of things that they will never ask you. They're never going to ask you for your name when they call you. They'll know that. If somebody's asking your name, they're not city tracers. They're never going to ask you for your social security number or any private financial information. They're not going to take credit card information. And they shouldn't be asking you to take control of your computer or download software to your phone, tablet, or computer. If someone does any of these things, hang up. It's a scam. Get out of the call. Don't even answer. Sometimes a contact tracer may come to your home to check on your well-being, especially if they haven't been able to reach you by phone. they'll have identification with them, so you can make sure they're who they say they are. I have asked them to give us a clue about how they will verify their identification for people who are blind. They haven't gotten back to me yet about that. They send out new information on testing and tracing weekly, and we'll try and keep that updated on our website. So you will have information about how to get to our website after the event, probably early next week, I think, when we send out the recording. And on that, you'll also have information about how to get in touch with Sydney. And my partner in this is Corinne Varela. And Corinne, I'm sorry I pronounced your name wrong. But she will be your contact if you have more questions or you're unsure about the information you're seeing. Corinne is the person who you will be contacting, and her contact information will be on the slides we send. Other than that, I'm really curious about questions you have. And when we get a question we can't answer, we'll be contacting the testing and tracing folks from HHC and asking your question. We'll get back to you either through ICS, or if you send an email or talk to Corinne, we'll get back to you that way directly. So, anyone with questions?
Yes, I have a question. Brenda Garbus. I'm a counsel with the New York State Commission for the Blind, so just wanted to full introduction. So I do work with blind consumers. I was just wondering, in terms of the tracer, is there any follow-up done after that initial meeting with the person who tests positive?
I think it depends on what the situation is. For example, if you need health care at home or you need to get health care somehow, they will be following up and giving you access to places in your area where you could go to get health care or have somebody contact you. I don't know fully. I will find out. I know there's concern about how people identify themselves as tracers if they come to your home. So I've asked that question and they haven't gotten back to me yet, but we'll keep on that.
There's a question in the chat from Robert Acevedo that says, what is that tracers do specifically?
They are responsible to reach out to people who have tested positive and find out how they're doing, first of all. So if you need help, if you need support, if you need health care, they can refer you. They're also going to be asking you about the people you've been in contact with since you've tested positive or just before that, so that they can contact those folks and let them know they've been exposed and give them guidance about what to do, like get tested, stay inside for, I don't know if it's 10 or 14 days now, but they know and they will impart that information. Does that help?
Can I share some information in the chat, Margie, about contact tracing from the CDC?
Sure.
Okay. So this is posted on the CDC website. It's called Contact Tracing for COVID-19, and it was just posted on August 31st, 2020. It's very recent. From my personal experience, I've gotten tested at least twice, and the first time around it was one nasal swab, and the second time around it was one nasal swab in one nostril. This time around it was one nasal swab in both nostrils. So they're actually now doing two nostrils instead of one, right? So with the coronavirus and COVID-19 and testing and tracing, they're always looking for new ways or new methods to actually be more effective with the results. So that's why they're doing nostrils instead of one, at least for where I went, which was in urgent care.
Right. And also, I think a lot of the links for more information are on the fact sheets that we'll be sending you. So if you have difficulty getting stuff off the internet or with the links, please contact Corinne and we'll get the information out to you. I think one of the main questions I have, because I haven't gotten how long does this come? I don't know how long they stay in contact. I think it will depend on how much support people need, or to get enough information to trace the contacts. I would love Capricia and Corinne and Regina to talk a little bit about being tested and what that's like for people.
Well, I was just going to say that I've heard from various people that they're a little hesitant to get tested because they think it hurts. And I had to get tested because I was having cataract surgery, and you can't have any surgery done right now unless you get tested. Right. But I can just say that when I went to the testing site, I said to the man who was doing the testing, and it was a swab in each nostril, I said, I have a sensitive nose, please be gentle. And he was, and it didn't hurt at all. It actually tickled. So, you know, and I often find that because I'm just sensitive in general. If I go to a doctor and I tell them what my sensitivities are, or a medical person, and I just tell them that they really try to be careful. So if anyone is concerned about that, I will just say, I would not let that stop you if you have a concern that you need to be tested. And just say to the person up front, you know, my nose is sensitive. Please be gentle. It'll probably all be fine.
Yeah, I'm a gagger, so I always have to say that for tests like this.
Yeah.
And good morning. My name is Manion Lyons. I have to say also that being a person with cerebral palsy, because we have spasticity, I did the same thing. I said I have a person. My disability makes me jump, no matter what you do to me, and especially if it's my first time. So it doesn't hurt, but it's very uncomfortable. And I suggest that if you take a muscle relaxer, take it before you have the test done, because it just relaxes your nerve and your body a little bit.
That's really helpful. Thank you so much.
Oh, Capricia has something to say. Okay, so I got the test in the nose 3 months ago. I was a bit nervous, but you know, my nose is very, very sensitive. So the woman, she said, "Oh, don't worry about it at all. You know, it'll be just for one time." And then I just took it like a champ. And then she put it in the tester, and then I already told her my nose is very, very sensitive. So I let the medical person know that. That was my experience with the test.
These are all very helpful pieces of information for us to pass along to people. Thank you.
No problem.
So I guess it's my turn.
Oh.
Hello, it's Corinne. I work for Sydney, as Margie mentioned, and I got tested because different people I know have been affected by COVID-19 and either were hospitalized or the worst happened. So with me and being someone with unseen disabilities and working and being alone, like living alone, right now it just became I have to make sure that I get tested because there are unseen symptoms. And I'm under 30, so I'm between 25 and 30, and they haven't seen symptoms for people my age. They've seen different symptoms for the general symptoms like a fever and things like that. But a relative of mine didn't have a fever, and I had a feeling they had COVID-19, and we got them tested, and they were tested, and they had to go to the hospital. So it just becomes their spouse was also tested and tested positive, but he didn't have to go to the hospital. So that's like the severe symptoms where they're both people with pre-existing conditions, but one ended up being in the hospital, the other one didn't, unfortunately. So I went to get tested, and they originally did it in one nostril. I told them my sensitivity levels because I can imagine, I saw that Q-tip looking thing. It was very long. Yes. And then when they shoved it up my nose, it was just like a reaction of a tear coming down my eye because it was a foreign object. The second time around when they did it in both nostrils, I didn't have any tears. So it was just that initial reaction of my body not being used to it. But the second time around, even though it was twice instead of once, I didn't shed a tear because at least I knew what was coming. So for people who are nervous about that, I think if you have different conditions or circumstances, it's important to get tested and to make sure that you're taking like the proper precautions. And like some of the symptoms, they also have some unseen symptoms. So that's why it's always important for the testing and tracing, so that at least you know whether or not you're positive or negative, and you know not to infect others, and you can better care for yourself. And if anyone else has those experiences or concerns, like please let us know, and I'll look up information to help figure out the different testing locations and distances, if that's also a concern.
We've had questions in the past about home testing for people who have difficulty getting out or traveling or just don't feel comfortable going out. I'm still waiting for an answer. We're trying to get as much information as possible about accommodating people with disabilities, and so far they've been vague. So my best advice to you is to call ahead when you've chosen a place. Make sure people know you have a disability that needs accommodation, and what accommodation would be helpful for you. The other thing is, if you have a bad experience or a less than desirable experience or difficulty getting the test, please contact us. We can contact the testing and tracing folks and let them know things are not going well for people with disabilities, if that's the case. I mean, I'm loving hearing people have made it through the tests okay. I don't know about the saliva test in New York City. I've not heard people getting that yet. We'll ask the question though, and I'll let you know, Brenda. What is Corinne?
I ended up posting something about the CDC diagnostic test for COVID-19, so it gives the background for the different tests and panels.
Yeah,
so if anyone...
It's just a question of whether they're all offered at all of the HHC sites, I think, right? So I'm going to try and find that out. Pardon me?
Yeah, and we'll also look into the level of effectiveness for the testing. If they have multiple tests, there's probably different levels of effectiveness too.
Okay. I think one of the things we are looking to do is spread this information. So if you have folks who want to understand what you've just heard about or would like more information, please let them know they can contact us. That's why we have the grant, and that's what we're doing. When you get the materials, Corinne, do you want to put up your email on the chat room?
Sure.
So everybody, you'll have Corinne's email, and please feel free to contact us to let us know who needs more information, or who has questions that we can help answer or get to the HHC folks for an answer. Brenda, do you have any more information about your folks and how testing has gone for them?
Not really. I have not at this point.
People are not.
I mean, maybe, one or two of my participants have done it. I have not heard. No, but that's why I attended today, because I wanted to hear what other folks' experiences were like, and also so that I could provide them with resources such as what you.
Good.
I certainly will encourage them to contact Sydney for more information about testing and contact tracing. I certainly will do that. But no, I don't have any, real tangible information to share, unfortunately.
I see Robert is asking about antibody testing. I will find out for you. I don't know if they take a blood sample, actually.
I went to CDMD a few weeks ago and asked about that. And yes, the antibody testing, they draw blood from you.
Okay.
Is the test freely available, the antibody testing? And do we know if it's reliable, and is it free?
At the CDMD, both tests were free.
Yeah, I think.
And the doctor said that it wasn't reliable, really. That's what the doctor said there.
Yeah.
Corinne's put up the link for the CDC to antibody testing information.
Okay, thank you.
Too, for you. So that should help. But again, what I will do is ask the New York City folks whether and how this is available. Whether it's available at all the sites, do you have to go to a new site?
I actually found a test site near you eventually. Do you want me to share that? Or do you want me to send it out in the email after the workshop and presentation?
Send it out afterwards, I think, yeah?
Okay. Sounds good.
So Corinne and I will be going over all of the information, making sure we have as much as we can in the materials we'll send you. And I don't know if anybody else has other questions. Also, let us know how we can help best. I think if you have ideas about us being able to supply information in a different way, or if you'd like us to talk at a different event, we'd be happy to do that.
I'm curious whether you've heard any ADA complaints about the testing sites.
We've had a couple of people tell us that they were not as accessible as they hoped, or that they were not I think when I'm talking about accessibility now, I'm not so much talking about physical accessibility as much as I am talking about somebody understanding how to accommodate somebody with a different type of disability. If somebody is very anxious, that may or may not be a disability, but I'm not sure people are geared to dealing with high anxiety, or people who are mistrustful, or for example, for folks who are blind, I think it's very important for testers to understand how to describe things to them.
Yes.
You don't want somebody shoving something up your nose and you don't have any idea that's what's happening.
Right.
Or, where you need to sit, how it's going to work, how much time they're going to take, what kinds of questions. All of that, I think, for people who are blind can be really helpful. Mm-hmm. Brenda, you probably know better than I do, but I'm not convinced they're trained to do that. Mm. I feel like they feel like health professionals already know, and we know that's not necessarily true.
Yeah, they know zero.
Right.
Yeah.
Well, we already know health professionals are not trained to work with people with disabilities in general. So, yeah.
Which is why I'm encouraging people to call ahead and ask the questions.
Yeah.
So that you don't go in and nobody's prepared to work with you.
Yeah.
Capricia, how did you do with, how did you communicate when you were getting tested?
Okay, so I went with my mom. We went, and the medical person, I told them that I was deaf, and the person explained very clearly with gesture and body language, and they explained how it's going to be up the nose, and just make sure that I understood everything. So, and then I went ahead, had the test. It was only a few minutes, and they went ahead and put in the test tube, and it was just a lot of communication with gesturing and body language.
You got a good one. I'm glad to hear it. I'm not sure everyone is that easy in accommodations.
Also, if you are an ICS Health Home member, just in general, if you need someone to go to the doctor with you and you don't have a family member or someone who can do it, you should let your care navigator know, because often we can arrange for somebody from ICS to go with you and help you. Yes.
That's terrific.
Regina, you read my mind. I was going to ask that same question. If you needed help with someone, who could go with you other than your home personal assistant?
Yes. You should let ICS know.
That's terrific. Good information.
This is Corinne. I think my other concern when I was getting tested was the first time around I went to my primary physician, and so that's within walking distance, like a 7-minute walk, and I could keep social distancing, and they had different procedures, and they met you by a side entrance, and they let you in on a certain day and time for testing. So beforehand, when I called in, I had to explain what was going on and if I was there for testing or a checkup, because they have 2 different entrances for those individuals. And then they take them separately than the waiting room. And then even the checkout separate. So I went by myself the first time around. The second time around, I wasn't able to schedule with my primary. So that's why I went to an urgent care. And an urgent care that I went to was in Park Slope area, so it was far away from me, and I didn't want to take public transportation, seeing as I don't know if I'm asymptomatic or if like I have symptoms but I don't have a fever yet, right? And like I ended up asking my mom to go with me because she drives and I don't drive, so I can avoid having to go walking and taking a train and a bus. Right. So I don't know if other people had those concerns and that's why they were hesitant to take that route. But thank you for mentioning that, Regina, about helping people commute, because that is a concern. And are you able to go to different boroughs or just stay in one area?
Well, ICS works in 4 of the 5 boroughs of New York City. So we don't work on Staten Island, but we work in Queens, Brooklyn, the Bronx, and Manhattan.
But this is just for your members, Regina, right?
Yes.
So you have to be a member of ICS to get that kind of help.
Yeah, it's one of the benefits of being a member of the ICS Health Home.
That's amazing benefit, by the way. Amazing.
Thank
Great.
you.
Okay. Well, I hope this has been helpful, and we will take your questions that we weren't totally sure about back and try and get some answers for you. And again, I want to encourage people to be in touch with us as questions come up or if there are ways that we can help. And I want to thank Regina and the crew at ICS for making this possible and doing such a great job of organizing it.
And we thank you very much.
And we hope we can stay in contact.
Hello.
Okay, I think unless people have other questions, I think we're good.
Any final questions?
Yeah, I have one. I'm sorry. I couldn't get. I have an aversion to having anything go either down my throat or deep in my nose, primarily because any type of infection or any type of particle that gets into that area very quickly express because it's near so many, sensitive areas on your body. I'd rather have somebody do a cheek than anything else. I can always swap my cheek with something after it. I just don't see the nose or the throat. I just don't see it.
Okay, what we'll try and find out is whether and where they're doing the mouth swabs for you, so you'll know that that you could go get tested that way. I don't have an answer for you right now, but we'll certainly find out.
Okay.
Well, thank you, everyone. And thank you, especially Margie. And
Pleasure. And Corinne.
And Corinne. And you'll be getting those materials soon.
Yeah.
And
we're just going to do a review of the stuff that you've asked before we send everything out to see if we can get those questions answered at the same time that we send you the other material. But I think sometime early next week, yeah, would be a good deadline.
Yeah.
Perhaps.
Well, let's see.
Midweek.
I'm not around next week. So if you want to send it, if you would like to send it out before I get back from vacation, I can share the email list with you. Is that a better idea? Or you
great.
Like, okay, I'll do that.
Okay.
All right.
Well, thank you, everybody. It's good seeing some of the faces that I've seen before. And we'll be in touch.
Bye.
Thank you very much. Take care.
Thank
Bye-bye.
you. Bye. Thank you.
Thank you.